Thank you for joining us today. My name is Allison Van, and I'm the Executive Director of SPARK, a Center for Social Research Innovation. Welcome to the second SPARK Talk of the 2021-2022 school year. We're excited to welcome Carieta Thomas joining us this morning from University of Calgary. And I'd like to begin by giving honor and thanks to the Haudenosaunee and Anishinaabe nations as the traditional inhabitants of the lands where McMaster stands. To say that is to acknowledge a debt to those who are here before us and to recognize our responsibility as guests to respect and honor the intimate relationship Indigenous peoples have to this land. Carieta Thomas is a PhD candidate in the Department of Sociology at the University of Calgary, the 2019-2020 recipient of the Vanier Canada Graduate Scholarship, and the Izaak Walton Killam Memorial Scholarship. We're so delighted that you have come to share your research with us, Carieta.
Hi, thank you. Good morning, everyone. I'm really glad to see a lot of people interested in labor and immigration. So I think we'll have a good talk today. I'm gonna share my screen. So the title of my presentation, the quote, "You're nothing," it's part of a quote from one of my participants. She, in a lot of ways, is the most vulnerable of the participants that I've interviewed so far. And she suffered many of the indignities and fears described by the other participants, but she did so without family support and has recently experienced homelessness. And this participant understandably declined to be audio recorded. So I don't have many direct quotes from her. So I decided to open the presentation with her voice. And the full quote was, "You're nothing in this country without papers." A discussion of caregiver employment or care worker employment is really important in the context of Canada and the US because the World Health Organization predicts a future deficit in care workers to serve the aging populations in both countries. Reports have shown that undocumented immigrant women often fill this void. They provide long-term care, child care, and healthcare in countries like Canada and the US, where there's inadequate public service in these areas. So any immigration regulation or management that restricts their ability to conduct this type of work will likely exacerbate the care deficit. And at the same time, employers are increasingly requiring proof of work authorization and background checks that may impact the labor choices of undocumented immigrants. Everybody has become an immigration officer. And it may lead to labor shortages in care work in both countries. So I like to use the picture that I did on my first slide of the woman and the little boy, because I think most people understand the reference to a Caribbean nanny or babysitter. It's a common image in real life if you've gone to a city park, especially if you've lived in New York, or if you've watched a 90s sitcom, because a lot of times they have make mention or have a character like that. Historically, women from the Caribbean gained migrant status and employment as nannies, home health aides, and domestic workers. Now those demographics have changed. Caribbean women are no longer the majority of care workers coming through legal channels like the caregiver program in Canada or H-1B visas. Instead, Filipino women are more likely to enter through these channels for care work and have become the focus of migrant care work research and advocacy. However, my research starts from the premise that these disruptions have not stopped the migration of Caribbean women to the US and Canada for care work. So the shift from Caribbean to Filipino caregivers does not indicate an abeyance in the migration of Caribbean women to Canada for care work, because the available information mostly pertains to legal entries. In fact, a forthcoming paper published by myself and Dr. Naomi Lightman, who's my co-supervisor, found that in Canada, Black ethnically Caribbean women have a 12.5% chance of working in care compared to only a 6% chance for white women. When we included women at the intersection of race, ethnicity, and immigrant status, we found the chances increased to 24.8% for Black Caribbean immigrant women. And that's from data from 2016. I'm hoping to understand the impact of what I call pre-employment screening technologies on undocumented Caribbean women who participate in the care work labor market. So these technologies include things like requiring fingerprints, social security numbers, or SIN numbers for work, regardless of whether these demonstrate any possession of the skills that are necessary for the job. It also includes the incorporation of care work into the gig economy, which is made clear by the proliferation of websites such as care.com and Sitter City. So my research explores the location of undocumented women from the Caribbean within the context of increased surveillance in the labor market. The overall focus of my study is how technology, and that's meaning technology, immigration technologies and labor market technologies, impact the labor market participation of undocumented care workers from the Caribbean. So my research questions are designed to explore these technologies as forms of pre-employment screening. Also, the study is a comparison between the US and Canada. Sorry. I'm exploring these issues on 3 levels. At the micro level, the study looks at the responses of undocumented women from the Caribbean to these approaches in employment screening. So to do this, I'm interviewing undocumented and previously undocumented women care workers from the Caribbean. And that's the Anglophone Caribbean, and including Haiti in that. At the meso level of inquiry, I'll explore the role of individual employers and employment agencies in deploying technologies that screen workers based on immigrant status. So I'm also interviewing key informants, such as private employers who may use websites like care.com and directors or owners of caregiver employment businesses, or those seeking to employ care workers. Finally, on the macro level, Canadian and US immigration policies and regulations will be analyzed through a discourse analysis. And here I'm conducting a Foucauldian discourse analysis. And this type of analysis has a focus on knowledge and power as interdependent. And it also sees discourses as productive, meaning they shape the knowledge people are exposed to, as well as how they act upon that knowledge. Finally, in thinking about the internalization of the border that has been taking place in both the US and Canada, many scholars see the internal enforcement of immigration laws as more geared towards disciplining certain groups into being a powerless, low-wage workforce with little resources or recourse in the face of exploitation. So basically a super exploitable class of workers. I'll look at surveillance or the threat of surveillance and identification as ways of disciplining the immigrant labor force. I also want to look at employment law. So that's where immigration and employment law meet, to look at how immigration and employment law work in conjunction to maintain super exploitable working class. Since I'm in Canada, when I mention undocumented immigrants, people always look a little confused because there's the idea that Canada has a more liberal immigration system. And they get even more confused when I mention people from the Caribbean, because that's not normally the group that's illegalized or marked as deportable here, and especially in the US. But I'm deliberately choosing to use this term because of the fact that it's more politicized, and because I'm exploring the labor market, where a person could be here legally, but not have the documentation that allows them to work. For my research, I'm operationalizing undocumented in a broader sense than we normally think about it. I'm defining undocumented as women who participate in the labor force by legally entering the country and A, not respecting the limits of their visa, or B, overstaying their visa permitted time, as well as by illegally entering the country, including those smuggled across the border. So before I talk about some preliminary findings of the study, I'd like to take some time to discuss the ethical challenges and strategies for working with the vulnerable population that I'm working with. And here we can be a little interactive. So just a break from me talking a little. Let's take a few minutes to think through the issues that might come up and some considerations that you'd have to make if you're going to conduct research with this type of population. What do y'all think are some of the things that we'd have to think about to work with an undocumented population in terms of a research study? Any thoughts?
Well, I think one of the things is to have extremely strong privacy controls and good secure storage of any data and protocols around what you're going to do with that data.
Yeah, that's very true. Anyone else? Okay, so like Allison said, I think we have someone said in the chat. Employer abuse, are these workers coming? Okay. I'll answer that question later as I talk. So as Allison said, the biggest concerns and risks of potential participants are privacy and confidentiality. And this goes for both during the recruitment process and once someone has decided to actually participate in the study. So I had to conduct a lot of research to figure out how I was gonna protect participants. So I think it's good to share those strategies. The first issue is in recruitment. So I'm conducting both direct recruitment through flyers and things like that, as well as Snowball. However, both of these are complicated by the fact that I need to minimize the amount of identifying information that I collect from the participants. I'm trying to use gatekeepers and intermediaries within the population to make initial contacts. I'm finding these by working with community associations. So in most cities with a substantial Caribbean population, each national diaspora has an association, and there's also an umbrella organization to facilitate collaborations among these associations. So I send them flyers for distribution to members, their listserv, and other potential participants. And the way I protect participants is by providing my contact information and telling the gatekeepers, so like the president or the communications person in the association, not to ask potential participants for their contact information. And instead to just give them mine. Another thing is that using community associations instead of service providers limits the potential that participants will feel like receiving services is conditioned on participating in the study. Also, I'm not storing any contact information for recruitment purposes. So for example, I give my contact information and then I wait for someone to reach out to me instead of taking someone's number from someone that said they might want to participate. So if one of the association communications person says, oh, I know this person and I think they might want to participate, and then I'll give you their number, I'll say, actually, it's better if you give them my number and tell them that they can feel free to contact me. Of course, this means that I lose the ability to reach out to people who, I mean, for them, my research is not necessarily a big priority. So they might never reach out to me and they might forget. But at the end of the day, it protects me from collecting information unnecessarily. So once contact has been made by a potential participant, I only keep their contact information until they have the interview. So this means that I'm not able to have any follow-up interviews, but it means that I stored less information that could be linked to that person. Another thing I'm doing is verbal consent instead of written consent. And that way they don't have to sign anything. I also use pseudonyms throughout the interview, the transcriptions, and for any future publications, I'll also keep the pseudonyms. And that's how I have everything stored with pseudonyms. I don't collect or store anyone's real name. So I also take some demographic information like age, but again, I limit that. So I don't take a person's age, I only take an age range. Finally, there's the issue of audio recording. And of course, there are many benefits to recording an interview. So I still would like to have most of my interviews recorded. And so far, that's been the case. Only one person has declined to be recorded. What I do is I use an external recording device that's password protected and not stored on a cloud anywhere. And then the recordings will be deleted after I've transcribed interviews. And this brings me to the COVID-19 related challenges. So I had originally planned on having face-to-face interviews in private locations, and I would have gone to the homes of people who didn't mind that, or I would have rented out those flexi office spaces and used like a sound machine to mask sound coming from the office and things like that. But then COVID happened, right? Right when I was about to go into preparation for my candidacy exam, COVID happened. And by the time I was doing ethics, which we do after our candidacy exam, we were basically in lockdown and the border was closed. So I had to prepare to do all my interviews online or over the phone. I opted to use WhatsApp, Zoom, and Signal. And here it's really important that I'm not recording anything on my computer. And that's why I have the external recording device. The interviews I've done on Zoom, people don't, one of the people didn't turn on their camera, but I will, and I will show them the external recording device. So recruitment has also been a challenge because I originally planned on attending association meetings to build trust with communities, but that hasn't been possible. So I've been sending emails to people who have not necessarily been the most responsive. And it's understandable because of all that's been going on for everyone, and especially care workers. The research of a PhD student is probably not necessarily a big priority for most people. I've gotten interviews so far by first interviewing people in my network, and then I've gotten like a few based on that. Because I'm from the Caribbean and I was once undocumented in the US as well. So part of the community, although there are people who I know who are not willing to participate. So, and that's understandable. Sorry. So I'm now restarting my recruitment by contacting some people who haven't responded. So I'm getting better reception now. I've had contact with some of the associations in Ontario and researchers who work with Caribbean people. So it's an ongoing process that I'm working through right now. And if you have any questions regarding this specific aspect of the research, then we can definitely talk more about it at the end. So now for the interesting stuff. I'll talk about some preliminary findings for the study. So far, I've interviewed 9 people, 8 undocumented or formerly undocumented participants, and 1 key informant who owns a healthcare staffing agency operating in New York and Atlanta. Here I have some important characteristics of the undocumented participants. So 6 of the 8 participants entered the US before 9/11. I'll touch on this later, but 9/11 was a critical turning point in US and Canadian immigration enforcement. Immigration was placed under the purview of the Department of Homeland Security in the US, and in both internal surveillance became more of a priority for both countries. It's also important to note that most of the participants were legal entrants to the US, except for 2 participants. I mentioned this because it's the case that a lot of Caribbean people enter the US and Canada through temporary statuses like tourist visas, and then overstay or violate the terms of their status. That's why it's important that I've operationalized undocumented in the way that I have for this study. So far, 3 of the 4 women interviewed came as an international student or dependent of an international student. The 3 other legal entrants came through visitor visas. They all either violated the terms of their status by working or fell out of status at some point. Finally, most of the women are still engaged in care work in some way. 1 owns a care work training facility, 1 is a travel nurse, 1 is studying to become a nurse, another is a physical therapist, and the other works at a hotel. And this is especially interesting because all of them discuss care work as a survival job rather than something they felt was a calling or had always wanted to do. So it's interesting that even after having been in the US for so long, they haven't transitioned out of care work. So there are a few preliminary themes cropping up. And by this, I mean things that were mentioned by all of the women interviewed in some way. I'm categorizing them as strategies for navigating the job market and employment process. Here you can see 2 numbers. The card on the top shows the shows the EIN number, and the one on the bottom in blue shows a social security number. And as you can see, they're both 9 digits and written in the same way. And you'll see why that's important. So the first strategy is based on the fact that in order to work in the US, you're required to have a social security number, which is like an SIN. However, most people who come as dependents of an international student are not allowed to work or obtain a social security number. So the women had to find ways around that. 2 of the people I interviewed came before that law changed in 1996. So they were initially able to get work permits, but after that, their work permits expired or their social security card had a declaration on the back that said valid for work only with DHS authorization. So that's what an international student social security card, for example, would say. These women use their social security numbers when filling out forms, but if they were asked to bring in the actual card, then they wouldn't return because it would reveal that they couldn't work. And that's what the first quote is discussing. So while a lot of undocumented people get fake socials, it's becoming increasingly difficult to do that without being caught. So most people just get work under the table without one. However, one of my participants mentioned that she got something called an employer identification number, which contains the same amount of numbers as a social and can be used to file taxes. So there are a few other numbers like this, such as the taxpayer identification number. And this person used this number in place of a social and was able to even work with a government agency for some time. And that's Joy. So the quote from Joy discusses that. And one of the participants who worked in Canada while undocumented paid someone to use their social, their SIN number, but she had no proof, like an ID that linked that number to her identity. And that presented a lot of issues for her. And the last quote is from that participant. I call this playing with numbers because of how many forms require a number that is structured in a certain way. And technology like E-Verify has changed the ability for people to use another number or to use someone else's number to work. And I'll explain that soon. Another thing that all the women did was work several jobs at a time. Most of them took care of more than one elderly person or child at certain times. And one person had a care work position and another job at a factory. Well, that was before immigration showed up at the factory that she was working at. I think normally we would think about this as a challenge rather than a strategy, but one of the participants described it as a strategy for keeping a low profile. So here we see Chantel talking about she would get smaller jobs that nobody else necessarily wanted, that allowed her flexibility, and it also allowed her to stay under the radar. I was gonna call this slide "Just Don't Go Back" because that's something that all the women described doing, but I think it really amounted to a strategic silence around their status. So it was a strategy they used either in the application process when they were asked for documents they didn't have, or if an employer asked for something they did not want to provide. The first quote is Chantel talking about a manager asking her if she was a citizen and stating that she didn't want to hire immigrants, even though you don't need to be a citizen to have work authorization. So Chantel took this as a sign that there would be other difficulties down the line and decided not to pursue that job any further. The second quote is from Donna, whose employer asked her to give her passport after she had been working in their home 2 months already. She saw this as threatening and decided not to return to work there. The third quote is from Joy, who also gauged employers' willingness to hire an undocumented person while she was being interviewed, and then that would determine whether or not she came back. It's also important to note that when I asked the women who they would share their status with, they all said they only spoke about their status with close family members like siblings or someone they thought may be of help. One person even said that they didn't share their status with even their family members who didn't live with them. So contrary to the notion that hiding status precarity or lack of status allows continued presence and survival, opportunity could be opened or closed depending on how much a person chose to reveal. So I see the disclosure or decision not to return to a certain employer as a calculation. And that's why I think strategic silence may be more appropriate in describing the reticence of immigrants around their status. So I also asked questions about how they thought their status impacted their interaction with employers or the people they cared for. And I also asked questions about whether they felt safe in the workplace. And through those questions, I learned about challenges they faced that I think are probably not unique in care work, but maybe exacerbated by being undocumented. And those include a lack of job security, the need to limit institutional interactions, wage theft, and constant vigilance. So these quotes speak to the women feeling like they had to put up with certain things for fear of losing their job and not being able to find another one. They mostly spoke about being more accommodating than they would have liked because they feared losing a job, knowing that it might be difficult to find another. And most of the time, this meant doing tasks that weren't a part of their job. So almost all of the women that all of the women that I interviewed talked about being asked to do tasks that they hadn't thought they would have to do based on when they first spoke with the employer, when they interviewed, and not feeling like they could say anything about it because of their status. One challenge I found especially troubling for them was that as women, often working in other people's homes and also caring for ill people, sometimes without proper training, they were very fearful of interacting with institutions such as the police and emergency services. So this could have to do with a perception that all of these institutions collaborate or are given power to enforce immigration laws. And that's a perception that I can't say is incorrect, especially in the US. These quotes show that even when faced with dangerous situations, the women were not willing to involve other institutions. Like they wouldn't, calling 911 was a big fear for them. Also, Joy talked about how necessary training is because she saw it as a form of self-preservation, because being able to perform tasks correctly, such as lifting a patient, could save you from having to call the ambulance. Another issue was wage theft, which was made easy by the fact that they were working under the table, or they didn't feel like they could make use of worker protection laws. Here we have two women explicitly discussing instances of wage theft, but deciding not to seek recourse because of fear that they would be caught. Here, Chantel is talking about, here Chantel is talking about a situation where she experienced wage theft. The person didn't pay her, but she didn't feel like she could call the police or go to anybody because she was afraid that immigration would become involved. Finally, and I really wasn't sure what to call this, all of the women I interviewed discussed constantly thinking about their status in almost every decision they made. I think not wanting to call the police or 911, as well as not seeking recourse for wage theft, had a lot to do with the fact that their status was something that the women were constantly thinking about. 3 of the women explicitly talked about going over hypothetical scenarios in their head so that they could have answers prepared. So Joy, for instance, had a position where she had to drive one of her clients to their hospital, to their doctor's appointments, but she didn't have a valid driver's license. So she used to be very worried about anything happening, driving very carefully. She also talked about not taking certain roads, not taking the highway, but also rehearsing things to say if she got stopped by the police. And this is something that they did, a lot of the women talk about doing. Here I have a quote from Janice, who was a participant who first came to Canada. She worked here while undocumented for years and then crossed the border to the US in a hidden compartment in an 18-wheeler truck. So she was the first participant that I really got to explore and think through the comparison between the US and Canada with. She came to Canada in the 80s. So her experience may not necessarily be similar to those of today, but I learned a lot about how Caribbean migrants used to cross the border and their feelings about the US versus Canada in terms of the undocumented experience. So here she's discussing her constant vigilance that made her unable to trust anyone she knew. She also discusses a compensation program for those who reported undocumented people. And this is my most recent interview. I'm going to have to do some archival research to find out about this compensation program because I haven't been able to find any official source on this. But she provides a lot to think about in terms of this theme. So aside from ramping up border enforcement, 9/11 also changed a lot in terms of internal immigration enforcement. And this is true especially in the US, but also in Canada. However, in the Canadian context, there's less of a discussion of undocumented people and workers because they aren't as many border crossings, and most people become undocumented after falling out of status. But it's important to discuss internal immigration enforcement, like the increased requirements for using SIN in employment, because that's one of the ways that immigration enforcement targets undocumented people here too. So some of the things I'm talking about are not only relevant in the US, they're important in Canada too. So after 9/11, immigration was put under the purview of the Department of Homeland Security in the US, and it became more of a criminal and security issue. Of course, this has a serious impact on undocumented people seeking employment. And this is the case even in care work, which for a long time had been an industry where undocumented women could easily find work. First, many employers, particularly in healthcare facilities, are requiring people to bring in the actual physical Social Security card. And a lot of people are also requiring you have an actual SIN. Like for me as an international student, I had to take the actual paper that they give your SIN number into the university where I am before I could work. So they're actually requiring the physical copies of these. So people who may have used their relative's number or maybe were working even though their social didn't allow them to work are no longer able to do that. And now with E-Verify, it's even easier for employers who use the system to know if a person's social matches other identification that they've given. So E-Verify is a federal program in the US where you enter information about a prospective employee, and it tells you whether they're authorized to work, as well as things like whether the name on their ID matches the Social Security number that they give. So another change is that in terms of the care work industry, licensing requirements have changed. So you used to be able to become certified as a nursing assistant or other care work physician with only a picture ID. One of the participants used her passport to get her CNA license. However, now many of these certifications require you to bring your original Social Security card and ID to the exam. I'm hoping to find out more about how this impacts employers in my other interviews, because Joy mentioned that many agencies are having trouble finding workers for the lower level care positions because of these new requirements. And also remember when I said earlier that training is really important for these women for various reasons. It's a protection for them in terms of their own status, but it's also a protection for the clients that they're working with. So not being able to have proper training is really problematic. Some states have regulations that are also more exclusionary than the federal law. So for instance, whereas E-Verify is voluntary according to the federal government, in Georgia, there are requirements for employers to participate in E-Verify if they want to access certain government contracts or funding. Again, this is something I hope to explore in my interviews with employers, and I have a slide where I talk about that. Driver's license was something else that has changed. In many states, you now have to prove legal immigration status to be able to get a driver's license. So for care workers, this is especially problematic because many employers prefer someone who can drive, and driving is also necessary for the piecemeal work that many care workers need to make ends meet. Finally, two of the women came to the US in the early 90s. One had come and gone back home and then came back. But in the early 90s, they were able to get work permits as international students or as the dependent of an international student. However, after 1996, so really not a post 9/11 change, but became more enforced after that, this was no longer the case. So this didn't stop them from finding work because it was still necessary since some of them were the sole breadwinners in their family, but not being able to work legally created serious challenges and dangers for the women. In the Canadian context, I want to mention the ubiquity of the SIN. So researchers on the markers of undocumented people in Canada discuss the SIN number specifically. Many people may not know, but your SIN provides an indication of your status. So for example, if you have an SIN starting with a 9, that indicates that you are a temporary worker and not a citizen or a permanent resident. And for employers, this could trigger them to ask for more information. And so that's even if you have an SIN. Another important factor in the Canadian context is how integrated systems and institutions are. In an integrated system, if you are under an order of removal that's flagged, that may impact your ability to open a bank account, a phone account, or attend school. And research done with undocumented immigrants in Toronto by Viegas found that people avoided these things in order to avoid detection. So this is really troubling because some of the women interviewed discussed how difficult and risky it was for them to have to depend on someone else to share their bank account with them. One of them lost a substantial amount of money in that way. Another discussed that because she was using someone else's SIN, she wasn't able to access healthcare only if she was going to use that person's name, but she didn't have an ID. And now she wouldn't be able to get a health card. So that's another problem. So none of the women I spoke with used technology to find work while they were undocumented, but two who are still engaged in care work said that the care work platforms don't really screen for work authorization, but the employers you would find using these platforms will eventually ask. So I'm looking forward to interviewing some people who came a little later to see how their experiences differ. The two people I've interviewed who came in 2016 and 2017 did not use the care work platforms. They found work through their own networks. Finally, I'll briefly discuss the interview that I've had with a key informant. He is the owner of a healthcare staffing agency operating in New York and Atlanta. And he has some pretty big contracts, like a contract with some public school districts in New York to staff school nurses. And the most revealing part of his interview was the focus on compliance when hiring, particularly for government contracts. So he uses a program that collects information from applicants and runs background checks. It looks up certifications and licensing, and it even goes far as notifying them when someone's licensing is about to expire. So this quote comes from part of the interview where he talks about using E-Verify to ensure that care workers are legally allowed to work in the US, and discusses exactly how much the E-Verify system tells the employer when they run someone through the system. So that's the second quote there. In his case, when someone comes up as using a false number, he asks them to correct any issue that may have occurred. And if they can't, then he doesn't hire them. So he doesn't report the person because for him, it's more about complying so that he can maintain his contracts with the government. But I'm scheduling more key informant interviews now where I'll ask about reporting to other bodies. And I'll have to look into how much the E-Verify system itself reports on its own. So that was probably a lot to throw at people, but I think it's indicative of research being an iterative process, meaning that we go in with a plan, but we often have to go back to the beginning and rethink, or sometimes our research participants lead us to think about a factor that we hadn't previously thought about. I'm really grateful to be able to continue doing this work, and I'm looking forward to where it'll end up. Thanks so much for listening. I'm really looking forward to any questions or thoughts that you have on what I've shared. I'm gonna stop sharing my screen so I can see everyone. Yes. Okay, So I think earlier I saw someone ask a question about, are these workers coming with visas or are they completely unprotected by the law? And I think I answered that in the presentation. Some of them come with visas. Some of them come with visas that don't allow them to work. Like if you're a dependent of an international student, you're not allowed to work. Some of them came without visas. Then there was the person who came in Canada. She didn't have a visa to be in Canada, and then she crossed the border to the US. There were two people who crossed the border to the US from Canada. And so they don't feel like they can make use of a lot of the employment protections. Any other questions or thoughts?
I have one initial reaction, which is, when I first read the description and heard the term surveillance, I think my thought immediately went to things like nanny cams. And so really trying to think about this sort of structural and institutional framework around being able to verify who everyone is and what their status is as a form of surveillance was really, it shifted the concept for me a bit, and I really appreciated that.
Thank you. Yeah, I'm looking at governmentality. So like I'm using Foucault, who talks about surveillance and surveillance being everywhere. Because I don't think we think about how ubiquitous surveillance is for all of us. Because we think about it in terms of things like physical cameras, but the more connected things are becoming and integrated systems are becoming, the easier it is to like know almost everything about people. Yeah. And I don't think people necessarily think about that always as like a hindrance in terms of labor market participation. But in the context of being undocumented, it's a major hindrance. Any other questions or thoughts? Yes. And
I'm going to appear because I think it makes it more personalized.
I do appreciate that.
Yeah, no, and I'm the one who asked the question about the visas because I know that Caribbean women and Filipino women, we had the Careworkers program, right? And it's gone through various sort of permutations, I think, from less and more restrictive of their rights. Does that program still exist?
It's been discontinued. So it started out as the live-in caregivers, and then they changed stop requiring live-in. Then it went to the care workers. And then there was another one most recently that was like a caregiver program, but that's been discontinued. So all of them have been like pilots. And the issue with the program was that a lot of people were never able to transition from being from the work they were doing into permanent residency because there was a
no, absolutely. I mean, that's there's a long history of Black women and Asian women mobilizing in Toronto around this.
Yes. Yes.
And so are these women in any way sort of, did you see any connections between their individual experiences and the organizational, with, sort of any mobilization around this question?
Yeah, definitely. So there are a lot of migrant and specifically care work migrant organizations because of the like the space that care work occupies that are asking for landed status. And that used to be something way back in the day that certain care workers, specifically white care workers from places like Britain, used to get landed status. So they would be permanent residents when they came to Canada. So that's something that people are really calling for now. And in other areas, the activism is around protections for care workers because of the privacy and the fact that a lot of this work takes place in homes, a lot of worker protections aren't available to care workers. So the international care work movement and domestic workers movement is about having those protections for people. So there's a lot of connection between what I heard people saying and what activists are calling for.
Okay, great. And the work, just before I close, the work of, my goodness, she's someone I know. I don't know why I always forget her name, the Black female law professor at McGill, who just came out with a book on the international domestic movement.
Oh,
yeah.
I did just read a book on the international domestic movement. I think the author's last name is Fish.
No. No. It's,
I'm gonna have to look it up. I will look it up.
yeah.
You said
So
a
check her
professor at
out.
McGill?
Yeah.
Okay, thank you.
And she's been writing about, her own mother was a domestic worker, actually.
Mm,
And so she's been writing about this subject for a while.
okay,
So I would highly recommend looking into her.
okay, I'll definitely look into her. Thank you.
Cool. Congratulations.
Thank you.
Exciting. Yeah.
Thanks for coming and
Yeah, my
listening.
pleasure. Yeah.
So we're actually just a little beyond 11:20, but if people have additional questions, Carrie, if you need to go, we understand. Otherwise, feel free to go. But yeah, we built this so that there's 10 minutes leeway if people want to be able to talk more.
Yeah, I can take any other questions that people have. Yes, Gerard?
Hi, great. Thanks for that talk. That was really great.
Thanks.
I was just wondering, you were talking about how this fits into the gig economy and the websites that were recruiting these workers. And I'm just wondering if these websites are based either in Canada or in the Caribbean itself, and if these websites are on the radar of any of the governments at all.
Yeah, so these websites like care.com and Sitter City, and there's another one for nannies. They're based in the US and Canada, the ones I'm looking at. So if you go on them, sometimes there are people who are actually like still in their home country trying to find work here. And sometimes I've gone on like the Facebook pages for these websites, and it'll be people from other countries trying to come here for work. And that used to be one of the ways when the caregiver program was open here in Canada, that would be one of the ways that women would connect with employers, potential employers, to participate in the program. So yes, I think they're definitely on the radar of the government. They're operating legally as legal businesses. A lot of them don't specifically ask for certain information when you're filling out like a profile, but like for example, care.com provides the documents that you would need. It's called, in the US, it's called an I-9. So you fill that form out to prove that you have work authorization, and care.com provides that document and tells employers about that. So if an employer wants to use those documents and wants to find out these things, then they can access that information through care.com. But care.com themselves don't actually require that for you to, if you're a potential nanny, it doesn't require that for you to sign up and fill out a profile. Yeah. So I hope I've answered your question. Anyone else or any other thoughts? Oh, thank you, Adele Blackett.
All right.
Okay.
Thank you so much, Carieta. This has been extremely interesting. And yeah, thank you everyone for joining us. We'll be back next Friday. It's going to be slightly different. Instead of our regular Spark Talk, we're going to be doing an open house for Spark. And so information about that is available on our website. But we'll be talking about the entire range of social research methodologies.
Sounds interesting. Thanks for having me, and thanks everyone for coming.
Take care, everyone. Bye.
Bye.